Hey everyone, and welcome to the show. You know, it's crazy to think back just a few years ago when everything seemed to change almost overnight.
Yeah,
It felt like the entire world shifted. Suddenly, just breathing the air felt risky.
right.
And every headline, it was like nothing we'd ever seen before.
Mm.
That was the time of the COVID-19 pandemic, a
Mm.
period that really, I think it's safe to say, touched every single person on the planet.
Yeah.
And in so many ways, we're still dealing with the consequences. Today, we're going to take a deep dive into a brand new book that tries to grapple with this massive event.
Exactly. And we're not here for just another sensationalized take.
Right.
We're here to look at COVID Wars by Ronald Gruner. This book, the author describes it as a fact-based historical commentary,
Okay.
and it tries to get beyond those immediate, those hot takes and emotional reactions we all had to really try and understand the pandemic from a broader perspective.
I like that. So it's not just kind of reliving the trauma.
No, it's a really detailed analysis, and it goes all the way back to the basic science of viruses,
Hmm.
all the way to, there's still unanswered questions about where COVID-19 actually came from.
Okay.
So it's trying to be pretty comprehensive.
It's ambitious.
It is.
So Gruner himself, he actually says in the book that a lot of those early books and articles about the pandemic, they were kind of trapped in the intense feelings of the time,
Right.
which, I mean, it makes sense. Everyone was going through
Or
it.
live in it.
But to this deep dive, we're going to use the insights from COVID Wars. By the way, there's a link to the book on Amazon down in the description if you want to check it out.
Yeah, definitely.
But our goal is to step back a little, look at the big picture of what happened, try to pull out the most important lessons from this period that we all went through.
Yeah.
And if you're interested in understanding this period of history better, make sure to hit that like button and subscribe for more deep dives.
Please do.
So, COVID Wars, Chapter 1. It takes us all the way back to the 1890s, the Russian flu pandemic.
Yeah.
And that's where we first hear this idea of contagium vivum fluidum.
Yeah.
What was so important about that discovery?
Well, the interesting thing is, at the time, it really challenged how scientists thought about diseases.
Okay.
So during the Russian flu, researchers, they were seeing these illnesses spreading,
Mm-hmm.
even when they filtered out all the bacteria that they knew about at the time.
Oh, so it was like something else was causing it.
Exactly. And this guy, Dmitry Ivanovsky, he was working with tobacco mosaic disease.
Okay.
And his work basically showed that there was this other thing, this tiny infectious agent that was too small to see with their microscopes.
Wow.
It was a radical concept back then.
I bet. So then, a few years later, in 1898, Beijering comes along. He confirms these tiny agents exist, and he gives them a name, virus. And of course, virus means poison in Latin.
Yeah, it does. It's kind of ominous, isn't it?
It really is. It's like right from the start, people knew these things were dangerous.
Yeah. Beijering, he realized that these contagious living fluids, as they were calling them, were different from bacteria. They could only reproduce inside living cells. That was a huge discovery.
And it makes you think, even with all the scientific progress we've made, when a brand new virus like SARS-CoV-2 pops up,
Yeah.
it still throws us for a loop.
For sure. I mean, we have so much better technology now.
Right.
But the initial response, it's always shaped by what we already know and what we don't know about this new threat.
It's like we're constantly in this arms race with the microscopic world.
Exactly. It's a back and forth. We figure something out and then they change on us.
Chapter 2 of the book, The Warning. This is about how President George W. Bush actually warned everyone about a future pandemic.
Yeah.
It's kind of eerie looking back and knowing what was coming.
I know, right? It really makes you think.
What did those warnings look like?
The book really emphasizes that Bush wasn't just making offhand comments.
Okay.
His administration, they understood the potential for a global health crisis. They did studies and made recommendations about how to be more prepared. But the question is, if we had these warnings, why weren't we more ready when COVID-19 hit?
Yeah, that's the big question, isn't it? What went wrong?
What were the things that stopped us from actually putting those early insights into action?
So we had the warnings. And then in January 2020, right as the pandemic was starting, we had the Crimson Contagion simulation.
Oh, yeah.
What did that tell us about how prepared we actually were?
Well, Crimson Contagion, it was this huge simulation. They had federal and state agencies involved.
Wow.
They wanted to test our pandemic response capabilities, and what came out of it were these recommendations.
Great.
They showed we had weaknesses in how different levels of government would work together, problems with our supply chains for medical stuff, and they said we needed clear, consistent public health messages.
Yeah, makes sense.
But the problem was the timing was so tight, we didn't have much time to fix these problems before the real pandemic hit us.
Oh, wow. So it was like we knew what could go wrong, but we just didn't have enough time to really prepare.
It's like we had the answers, but not enough time to study.
Then we hit chapter 3, the beginning. And this period, there's just this feeling of chaos. And the book talks about this unfounded optimism that was going around, especially from the Trump administration. They were saying things like, there isn't a coronavirus second wave.
Yeah.
It seems like they just totally underestimated how dangerous this was.
It really does. There was this disconnect, right, between what the scientists were starting to learn and what was being said publicly. Even the World Health Organization, their early assessment about whether it spread from person to person, they were cautious at first and then had to change their stance.
So there was a lot of confusion even from the experts.
Right. And then you had people saying the virus would just disappear.
Well,
it created this very mixed message for the public.
No wonder people didn't know how to react.
Exactly.
The book talks about what Dr. Fauci was saying back then. Yep. He was comparing it to the flu, which usually dies down in the warmer months. But he also said this was a new virus. We didn't know how it would behave.
Right. There's always that uncertainty with something new.
Then we get to chapter 4, the divide. And now we're in the latter half of 2020.
Oh, yeah.
And things are starting to get really divided politically.
It was a tough time.
Republican states are opening back up, and Democratic states are staying closed. It really felt like the pandemic was becoming a political issue.
Well, what was striking is how things like public health measures became so political.
Yeah.
The book mentions some influential people who were framing mask wearing, as this political statement, not about public safety.
It's like wearing a mask became a symbol.
Exactly. And it really wasn't like that with public health issues before.
The book also brings up some moments that felt like hypocrisy.
Oh, right.
Like when Governor Newsom had that dinner at the French Laundry.
Yeah.
And Dr. Birx traveling for Thanksgiving.
Yeah.
It felt like it didn't matter what the guidelines were. Some people weren't following them.
Whether they were actually breaking the rules or just seemed like they were, it really hurt public trust.
Right. It made people question if the rules even mattered.
It makes you think about how important it is for leaders to set an example during a crisis.
Chapter 4 also talks about Dr. Scott Atlas.
Yeah.
And his focused protection strategy. He was going against what other people on the COVID task force were saying, like Dr. Fauci. Could you explain what his approach was all about?
Sure. Dr. Atlas, he came from a neuroradiology background.
Okay.
And he argued for this strategy where you focus on protecting the people who are most at risk.
Okay, so like older people and people with health problems.
Exactly. And his idea was you let the virus spread more freely among younger, healthier people to try and reach herd immunity.
Herd immunity, right.
And this aligned with what was in the Great Barrington Declaration.
Remind me, what is herd immunity again?
Oh, right. So herd immunity is when enough people in a population are immune to a disease, either because they've been vaccinated or because they've already had it.
Okay.
And when you have herd immunity, it's harder for the disease to spread.
Got it.
That was his thinking.
But then the book shows this data, figure 4.8, and it says that states that were more open actually had a lot more deaths from COVID-19.
Yeah, that's right.
So what does that tell us about focus protection? Did it actually work?
Well, the idea behind focus protection was to minimize disruptions to society. They thought if they could just protect the most vulnerable people, they could keep things running more normally.
Right.
But the problem is, communities are so interconnected. It was really hard to just keep the virus contained to younger people. So those higher death rates in the more open states, they suggest that the focused protection idea, without other strong measures to slow the spread, ended up with more people dying.
So it was like trying to control something that was just too hard to control.
It's tough, with a virus that spreads so easily.
And that brings us to chapter 5, the vaccines. And this is where we talk about Operation Warp Speed. It was this huge effort to develop vaccines really quickly.
Yeah, Operation Warp Speed was amazing. They mobilized scientists and companies like we'd never seen before.
Right. It was like something out of a movie.
I know, right? And they managed to develop multiple safe and effective vaccines so fast, it's incredible what they achieved.
It really shows what we can do when we put our minds and resources to it.
The book actually mentions the Brigham study, which goes into detail about the money that went into this effort. billions of dollars, both for research and for making sure there were enough vaccines for everyone.
And of course, all that money, it led to big profits for the pharmaceutical companies.
It did. It's a reminder that there's a lot of money involved in healthcare, even during a crisis.
Chapter 5 also talks about how the public reacted to the COVID-19 vaccines compared to the Asian flu vaccine back in 1957.
Oh, yeah. That's an interesting comparison. Back then, people were really eager to get the Asian flu vaccine. But with the COVID-19 vaccines, there was a lot of skepticism, especially among Republicans. Figure 5.2 in the book shows that pretty clearly.
It's crazy how different the reactions were. Then President Biden, he tried to make people get vaccinated.
Right, he had those vaccine mandates.
But he got a lot of pushback, even from some Democrats. Why do you think people were so hesitant about the COVID-19 vaccines?
Well, the book talks about how there's been anti-vaccine movements for a long time, going back to the 1800s.
Wow, really?
Yeah, and in more recent times, you've had this misinformation linking vaccines to autism.
Right, I remember hearing about that.
And even though they're rare, there have been problems with vaccines in the past. Things like the Cutter incident, which really scared people.
What was that?
Oh, it was back in the 50s. A batch of the polio vaccine wasn't made properly, and some kids actually got polio from it.
Oh, that's awful.
A terrible tragedy.
But those are so rare.
They are, but they stick in people's minds. And then, of course, with COVID, everything became so political.
Yeah.
Whether or not you got the vaccine became tied to your political identity. We didn't see that with the Asian flu.
It's like the pandemic just amplified all these existing divisions in society.
Absolutely. It was a stress test on so many levels.
Chapter 6, COVID deaths.
It's a tough one to read. The book talks about how over 1.1 million people died from COVID-19 in the U.S. alone.
It's a staggering number.
It is. And the book also points out that the death rates were really different depending on what state you lived in.
That's right. Some states were hit much harder than others.
What does the book say about why that was?
Well, it seems like a bunch of factors played a role. Things like obesity rates, how good the healthcare system was in a state, even the political climate.
Politics, really?
Yeah, the book compares Midland County, Texas, and Chittenden County, Vermont.
Okay.
They have similar incomes, but their politics, their healthcare systems, and their vaccination rates are very different.
And Midland County had way more COVID deaths. It's like those bigger societal factors really made a difference in how people fared during the pandemic.
It's a reminder that health isn't just about individual choices. It's also about the systems and the environments we live in.
Exactly. It's about the whole context.
And while most of the people who died were older, a lot of younger people died too.
Yeah, and when younger people die, it's not just sad, it's a huge loss of potential.
It's like all the years they would have had.
It adds to the overall impact of the pandemic, you know?
Chapter 7 is about alternative facts and conspiracy theories. It felt like with so much uncertainty, misinformation just exploded.
It's like the pandemic created this breeding ground for conspiracy theories.
Why do you think that was?
Well, people were scared. They didn't know what to believe. And with the internet and social media, these unfounded theories could spread so easily.
Right. And the book mentions how years before, the FCC fairness doctrine had been repealed.
Oh, yeah.
That meant there weren't really rules anymore about presenting balanced viewpoints on the news.
Right. So it was easier for misinformation to slip in.
The book talks about some of the big ones that went around, like the pandemic videos.
Oh, yeah. Those are wild.
And the Great Reset conspiracy theory.
It's amazing how these things take hold.
What was the Great Reset all about?
It came from this initiative by the World Economic Forum.
Okay.
They were talking about using the pandemic as an opportunity to make big changes in the world, to kind of reset things.
Okay.
But then people started twisting it into this conspiracy theory about global elites trying to control everything.
So it started with a real idea, but then people took it to a whole other level.
Exactly.
And then there were all the conspiracy theories about the vaccine.
Oh, yeah, like they were changing your DNA or putting microchips in you. It was crazy.
It's like people were looking for any explanation other than what the scientists were saying.
Well, the book talks about how trust in institutions like the government, the media, science, it was already declining before the pandemic. Figure 7-6 shows how that trust has been eroding over time. And when people don't trust the authorities, they're more likely to believe these alternative explanations, even if they don't make sense.
It's like they're looking for something to believe in when everything else feels uncertain.
It's a natural human instinct.
Chapter 8 is lockdowns and their effects.
Right.
We all remember those lockdowns. They were meant to stop the virus, but they really impacted our lives.
Yeah, it was a strange time. The book talks about how the lockdowns caused huge economic problems, like tons of people losing their jobs. Figure 8-9 shows just how bad it was.
I remember those days. It was constant bad news.
And the lockdowns, they were tough on education too. Kids were out of school and their learning really suffered.
Yeah.
Figures 8-3, 8-4, and 8-5 show that pretty clearly.
And we're probably still dealing with the effects of that.
Absolutely. It could have long-term consequences.
The book also talks about Sweden.
Oh.
They did things differently. They didn't really have lockdowns,
Mm-hmm.
but the results were kind of mixed.
It's true. They avoided those immediate economic problems that came with the lockdowns.
Okay.
But they had more deaths early on than some other countries.
Oh, wow.
And eventually they had to start putting some restrictions in place anyway. It's a complicated situation, you know?
It really is. It's like there's no easy answer.
What's really interesting, though, is that despite all the job losses and economic problems, corporate profits actually went up during the pandemic. Figures 8-10 and 8-11 show that. And the gap between the rich and everyone else, it got even bigger.
So it's like some people actually benefited from the pandemic.
It seems that way.
It's wild how these things play out. Then Chapter 9 talks about excess deaths beyond COVID. So this isn't just people dying from the virus itself.
Right.
It's about the increase in deaths from other things, like heart attacks, cancer, strokes.
Right.
It's like the pandemic had this ripple effect on people's health.
It makes sense, doesn't it? There were so many disruptions. People couldn't get the health care they needed.
Right.
Diagnoses were delayed. And then you have the stress and anxiety of the whole situation, which can affect people's health.
The book mentions something called deaths of despair.
Oh, yeah. That's about people dying from things like drug overdoses, alcohol abuse, and suicide. And those deaths went up during the pandemic, except for suicide, which actually went down.
Oh, that's interesting. Why do you think that is?
Well, there are a lot of theories. Maybe people felt more connected during the pandemic, even though they were physically apart. Or maybe it was because of the government support that was available. But it's definitely something that researchers are still trying to understand.
The book also talks about how homicides and accidental deaths went up during the pandemic.
Yeah, those increases are likely tied to all the stress and disruption that was going on. It was a tough time for everyone.
Okay, last chapter. Chapter 10 is historical perspective. It compares COVID-19 to other pandemics, like the Spanish flu and the Asian flu.
Ah, yes. The book points out something really interesting. The death rates in developed countries during the Spanish flu, they were actually pretty similar to the COVID-19 death rates.
Wow, I didn't realize that. But the Asian flu in 1957, that was handled a lot better in the U.S., right?
Yeah, back then, people really trusted the government and scientists, and they developed a vaccine really quickly.
So that helped a lot.
It did. But with COVID, you had all this political division and mistrust. It made things so much harder.
It's like we didn't learn the lessons from history.
Maybe not as well as we should have.
So what's the book's overall takeaway about how America handled the pandemic?
Well, it suggests that we weren't really prepared, even though we had warnings. And our divisions as a society, they made things worse. The book predicts that future historians are going to be pretty critical of how we responded.
It makes you think about what we need to do differently next time.
Absolutely. We need to be better prepared, and we need to be more united.
Because there will be a next time.
There's always a next time, unfortunately.
Then there's the epilogue, which talks about the origin of the virus, which is still a mystery.
Yeah, it is.
The book mentions both the animal market theory and the lab leak hypothesis.
Right, but it also says there's no conclusive evidence for either one. And the whole investigation, it's become so politicized.
So we might never know for sure where it came from.
It's possible.
Well, this has been a pretty heavy deep dive into COVID wars. We've covered a lot, from the science of viruses to the political and social impacts of the pandemic.
It's been quite a journey.
It really has. What was the most surprising or impactful thing you learned today? Let us know in the comments below. We love hearing your thoughts.
Please share your insights.
And if you found this deep dive valuable, please hit that like button and share it with your friends. That helps us reach more people and keep these important conversations going.
It does.
As we look to the future, let's all think about the lessons we've learned or maybe haven't learned from the COVID-19 pandemic. How can we use those lessons to be better prepared for the next global challenge, whatever it may be? Because as we've seen, history has a way of repeating itself if we don't pay attention. Thanks for joining us.